Okay, so I'm Rain Osborne, the chair of the FPTA nominating committee, and I'm here today interviewing Thomas Eberle, who is the candidate for president for the FPTA. So Thomas, why don't you tell us a little bit about yourself and your background?
Great. Well, thanks, Rain. First of all, I'd like to thank all the members who nominated me to run for president of the FPTA. It's a big responsibility. All 18 members of the board, they are service positions, and they're a great bunch of people to work with, and that's one of the motivating factors for myself to really run for president. And so I'd like to thank the nominating committee as well for asking me to run a second time. I declined last term, but I've had great mentorship under Kathy Swanek as the rest of the board. She's been a great leader, and she finished her second term, so I thought now was the right time to really lead the profession, lead the organization. As far as my experience goes, I graduated from a university, Duval College up in New York, with my master's degree. I then did a 2-year orthopedic residency for my doctorate, and then I did a fellowship as well. So I've been mainly a clinician for the last 18 years. However, I just joined the University of St. Augustine as full-time faculty this previous January, and I'm teaching orthopedics at the new Miami campus for the University of St. Augustine. As far as my board experience, I was elected to the board 4 years ago as the Southeast District Director. After my first year, I was elected by the 18 board members to the Executive Committee. The Executive Committee are the 4 officers, which are the President, Vice President, Treasurer, and Secretary, and then one remaining position is elected from the board. So I've had that position for the last, I've been elected to that position on the board the last 3 years. The Executive Committee really is involved with all aspects of the organization. As the Southeast District Director, when I'm wearing that hat, I'm really the liaison between the district and the board. The Executive Committee, we oversee the 4 pillars of our association, which is public relations, membership, advocacy, and practice, as well as the financial component, the finance component. It's been great. I've really jumped into it, and I really love the people I work with, and many of you probably know me from my advocacy efforts, doing different PT PAC continuing education courses around the state, where I volunteer my time to do a half-day course and raise money for PAC. So if you've attended one of those courses, that's fantastic. But our profession is at a critical junction right now. It has been for the last couple years. There's a lot of change in healthcare right now, and the association's job is really to represent us because no one else is. And we have a great group of people that are doing it and taking care of it. So
great. And so could you also tell us a little bit about your vision for the FPTA, and if elected president, what would you do to achieve that vision?
Yeah, and that's a great question, because that's primarily one of the things the president does is lead. We have a lot of members. We have 18 members on the board, as I stated. We have dozens of members across the association. So, I'm not going to be able to get anything done by myself. No one is. It takes a team to really energize our whole group and get things done, because we're up against a lot of other stakeholders that are very powerful. And it takes it's amazing that we do what we do with the amount of money we actually have in our profession, based on other professions that try to limit us. But the first aspect I would address, I think is the most important, is the practice under the practice and advocacy pillar. As a chair of the Work Comp Task Force, a year ago, we identified that specialty networks, which are worker comp specialty networks, they're kind of like middle managers within workers' comp, they're taking about, in some cases, over 50% administration fee. So if you look at the average reimbursement for the state for a workers' comp visit, it's over $125, really over $130. And many of our providers are reporting to us that they're receiving payments of less than $70, in some cases $50. So when you look at the national average of workers' comp administration fees, the national average is 15 to 20%. The Affordable Care Act that was passed a few years ago by law mandated that insurance companies, regular private insurance companies, couldn't take more than a 20% admin fee. So here we are in the work comp system, and we brought it to the work comp board attention, and they had no idea this practice was even going on. They were aware of the specialty networks, but one, they weren't aware. They actually told us that the specialty networks account for 7% of all workers' comp business, and we know that's not an accurate number. Okay, number two, they weren't aware that the administration fees were sometimes over 50%. So this is a huge issue because practitioners know when you're treating workers' comp, the reason the fees are higher, the reimbursement's higher, is because there's much more administration cost to the practitioner and the clinic owners to treat that patient. It's not just the clinical treatment, there's a lot of paperwork involved and administration involved. Similarly, under that pillar, we have to continue to be on guard and watch with private insurance companies. Tad Fisher, our CEO, has been instrumental at making introductions at places like Blue Cross Blue Shield and Cigna. Our former president, or current president, Kathy Swanek, who's met last month with Greg Hartley, our director of practice with Cigna, because Cigna just decided to use one of these middle managers for reimbursement, and clinicians, owners were getting new contracts that were decreasing their reimbursement to $38, under $40. And so our association, we met with them and we explained to them what was going on. It's interesting, as usual, you know, these big corporations, sometimes they're not always aware what one hand's doing, the other hand doesn't know. And after a month, we set up a toolkit online for private practice owners and people to, clinicians to work with these contracts, and we educated people on the nature of these contracts and how to negotiate if they wanted that advice. And then those clinicians made individual contracts, because it is an individual. As the association, we could just advise. And we're getting reports back from clinicians that they're getting close to or the same rates that they had previous. So that was another win for us. But you know, without the association getting involved, we wouldn't have gotten that. You know, and honestly, without membership giving us the feedback to let us know this was a problem, we wouldn't have known that was going on either. Because it's not like Cigna just, you know, put up a billboard and said, "Hey, we're reducing reimbursement to $38." You know, it's just kind of one of these sneaky things on page 3, paragraph 4. You know, by the way, so you really have to read contracts closely, and they are looking at any point to cut our reimbursement, and physical therapy is one of those services that they come after. As far as copays have been an issue, we're continually meeting with different insurance companies. We're trying to educate them on the fact that when you see a primary care physician, you're probably seeing them once or twice a year, or maybe if you're sick, a couple times in a month. And physical therapy, when patients are going to see a physical therapist, they're coming 2 to 3 times a week. And if the copay is $50, that easily gets up over $500 a month. And that's just not sustainable. So we understand that the patient has to be responsible for part of their, you know, services. So people just don't access services and treat it like a spa. We understand that. But at the same time, if you are injured or you had a surgery, whatever is going on with you, and you need physical therapy services, you know, paying out of pocket over $500 a month is not fair. And realistically, some of these insurance providers are charging $75 copays, but their reimbursement is less than $75. So they're actually asking for money back from the provider. So, you know, Rain, you're injured, you go in, you pay your $75 copay, I treat you, and now insurance company X is asking me for $10 of that visit. So in effect, it's a lie that you have coverage at that point, because you don't have coverage. You're paying out of pocket cash, and then I'm reimbursing the insurance company. So it's not an ethical practice. It's not. So we also have a practice issue with advocacy issue with dry needling. Dry needling affects, granted, a small portion of our practice, but an important portion. It's an effective tool that physical therapists and outpatient clinics can utilize in other states. Over 2/3 of the states in the United States allow dry needling. Our Practice Act is silent on it, but we've had discussions about this over the last few years, and the Florida PT board, they're telling us that we do need legislation on it. So we're working with the board still. We kind of have a two-pronged approach. We're also collaborating with other providers, other provider groups, and I don't want to get into the details of that, but we are collaborating with other provider groups to build a coalition to support legislation. This is very frustrating for many therapists, I know. They want to practice dry needling, they've dry needled in other states, or they want to become certified. As an orthopedic fellow, I'd love to have dry needling here personally. But you have to remember, it took us 5 years to pass a Practice Act. 5 years. And we did that, and last year it was voted unanimously, but it took us 5 years to do that. Okay, it took us 5 years to even get a vote on it. So dry needling, we're going up to Tallahassee, and they know what physical therapy is now because we've been advocating strong the last several years. They don't know what dry needling is. They don't. They're mostly lawyers, and we have to explain to them what dry needling is. And then they have many other voices in the room saying, well, dry needling is acupuncture, which it is not, and physical therapists are going to practice this and be dangerous, even though it, 2/3 of the other states in the country can do it, and there's no issues with patient injuries. So these are the types of things that we are up against to get this. So that by collaborating with the other groups will help us, or at least they won't block us in our goal to get dry needling as a tool we can legally do in Florida. Interestingly, last year there have been individuals that applied for an exemption from the board. So we have at least one person in the state of Florida that we know about that has an exemption to practice, and that applies to that single person. That person moved from another state, applied for the exemption, and they got it. So that clinician can practice. So we're having some of our members think about whether they want to apply for an exemption or not, but that will be their individual decision to do that. So that's that two-pronged approach, legislative and exemption. But at the end of the day, even if you have an exemption, we need legislation on this. Even if the Florida board creates a rule, that rule has been challenged in other states. So the case closed, shut is just getting legislation, so it's on the books, and then it's black and white. You can do it, and if you want to get certified in it, you can. Finally, regarding membership, I think that we've been doing a better job at the APTA and the FPTA with social media, but we need to engage more. And I have a plan for that. There's certain members on the board that are going to help me with that plan. And we just need a bigger presence online, because that's where a lot of our members are. Twitter, Instagram, Facebook. I have a big online presence on Facebook. Other members of our board or active leadership within the FPTA are on Twitter and Instagram. So that's how we can get the message out to our younger professionals or any professional that's not a member yet. We need to demonstrate to our physical therapists in Florida how expensive it is to not be a member. We hear all the time, it's too expensive, it's $495 or close to $500. If you add a section on top of that, it's more. We need to explain to people and get the message out how expensive it is that they're not members. And the reality is when we go to Tallahassee and advocate, when we meet with Blue Cross Blue Shield or Cigna, whoever it is, we're not advocating just for the members of the FPTA. We're advocating on behalf of the whole profession. And the reality is that there's a lot of people out there getting a free lunch right now. And that's the truth, and I understand, believe me, I understand people have financial hardships or they switch jobs. I know there's a whole litany of things that are reasons why not to be a member. However, I know private practice owners, successful private practice owners that aren't members. And I know that they don't even know that we have a private practice SIG, which is hugely, hugely important within that group of private practitioners. And they share ideas and practices, salary costs, hiring practices, when these things like Cigna and issues with Medicare come up. So these are the types of things that we need to educate our members on, where they don't even know that we have programs for this. So finally, you know, I've worked in the corporate world. I worked with a pre-runner of Select, which was Cora, Health South. I've done consulting with Cora. I've through my consulting business, I've consulted with many private practice groups. I've worked in the hospital setting. I'm now in academia. I wanted to run because I do think I can make a difference. I think I have key contacts in a lot of different groups. And my goal is to engage those groups and promote our membership and promote what the FPTA is doing, because I think when the individual members actually get the message in front of them, I think we make a very compelling argument on why you should be a member and why that's important. So.
Great. Well, thank you. Thank you very much. And so I have one final question for you, and this is to help the the membership just get to know you a little bit better as a person. And so, what's your spirit animal and why?
Wow. Well, I would have to say a wolf. I would say a wolf. Yeah, because if you know me, or if you see any of my Facebook posts, my wife and I, we have 2 dogs, and wolves are. Sometimes people think of wolves as being this really aggressive creature, and they're not. They're pack animals. They support each other. They live in groups, and they coordinate. And when you look at wolves, especially when wolves were reintroduced into the wild in Yellowstone recently, it actually helped the ecosystem tremendously. And there's very good evidence for that, not just with keeping the animals healthy, but just allowing the plants to return, because a lot of the herbivores aren't destroying them. So you have to have that balance. But I like wolves because they are fierce and protective when they need to be. And I would say I definitely have that quality. If you've ever heard me speak on advocacy, you'll see that wolf side of me. But they're also very loving and committed to family, which I am as well. So I think that describes me well. So
that's great. Well, thank you so much. Well, thank you so much, Thomas. That was very informative, and best of luck to you in the election.
Great. Thanks again, Rain. Take care.